Hi everyone. So today I'm going to talk about post traumatic stress disorder or PTSD. So PTSD basically is a kind of stress disorder or anxiety disorder that usually happens to an individual when he or she experiences or witnesses a particular traumatic event, which can be as simple as a dog bite or a nightmare, and as difficult as sexual assault, natural calamity, car accident, etc. So the population statistics says that out of every 100 individuals, there are 7 to 8 people who are most likely to experience this once in a lifetime, and it might lead to a range of symptoms like breathlessness, increase of the heart rate, uh, constant feeling of fear, hopelessness, the trembles and the shivers in your body, etc. So, we are going to talk about the stages of post traumatic stress disorder. So, the first stage is the impact stage. So, impact stage is the immediate stage when he or she experiences that particular traumatic event and they are struggling to deal with it. So, this stage is the first stage of PTSD when a person is involved in the event and they are trying to cope up with that. The second stage comes is the denial stage, where a person's body or the person's mind has its own ability to fight against a particular feeling of fear or constant hopelessness, where their mind will try to address the issue or just try to eliminate the feeling of anxiety or stress when they are experiencing it. And not everyone who are suffering from PTSD are able to cope up with it. The third stage is the rescue stage. So when the person realizes or acknowledges the fact that, okay, I have undergone through this particular traumatic event and I'm going to come out of it, when they try to come out of it, so it's like it's a kind of therapy. Also, it's a kind of behavioral cognitive therapy where a person tries to like remember the traumatic event and tries to cope up or tries to normalize it, dealing with the shock or the kind of distress that they have faced. The fourth stage is the short term recovery stage, where an individual tries to lead a normal life by accepting the fact, okay, that this is what has happened to me. Now I'm going to deal with it, I'm going to like live with it. So the short term recovery stage is the stage where an individual seeks help from their loved ones, because this is how they try to heal and they try to see or enjoy the positive outlook of life, including a plan of like going through the traumatic event, acknowledging it, accepting it, and then overcoming it. So the fifth stage comes with the long term recovery stage, where a person in combination with the support from their loved ones tries to cope up the situation they are in, and they are like addressing, or we can say implementing the new coping mechanisms to live a better life, to live a life with the strategies and skills to forget or to just eliminate that feeling of stress. Now the question says that how long can PTSD last for? So PTSD can last for up to weeks to up to 6 months, depending on the kind of or the range of experience the person has. And if the person is constantly suffering with some or the other events in life that are contributing to the additional symptoms, like any event might trigger to that, so it might last for a longer time. So what is best is that they should seek help, they should talk to people around them, or even go for a medicative therapy. They should take uh, some kind of medications that might help them to reduce their anxiety, get a better sleep. How it feels when you have PTSD. So it is not same for everyone. It is, people may experience a range of symptoms like a kind of constant pressure in their body, even if something is not physically there, or the experience that has caused them in this state, even if that has passed, they will have that constant pressure that is still happening to them. uh, a sudden outburst of emotions like horror or fear or a complete distress that might lead to panic disorders, panic attacks at the worst. People are not able to sleep in nights, they wake up in panic, and a constant feeling of increased heart rate. So, the important thing here is that you should just talk to somebody who is very close to you or seek a medical advice if you're not able to manage up that anxiety or stress that has happened to you, because medications will definitely help you in trying to get a better sleep or reduce the feeling of anxiety. And medication, along with the constant support of loved ones, will definitely take you out of the situation or the traumatic event that you have experienced. Thanks a lot.